Hi friends, welcome to the channel. Here we are discussing about pharmacology NCLEX type questions and answers with their rationales. And if you are not subscribed to our channel, please subscribe. This is second video of today. So we will finish it a little faster. So I already got so many comments to make faster. So I will try to make faster here. So please cooperate. So we'll go to our topic, pharmacology questions and answers. NCLEX type pharmacology questions and answers, which will be helpful for your preparation, ESIC and Kerala PSC staff nurse examination preparations. So please join with me. We'll go to our topic directly. The group of drug that cause the major side effects of nephrotoxicity is. The group of drug that cause the major side effects of nephrotoxicity is penicillin, sulfonamide, aminoglycosides, tetracyclines. Hi, good evening, good evening. Mancor, Diamond, Marmo. Please try to give your answers fastly. So we'll finish it. Nephrotoxicity. The group of drug that cause major side effects of nephrotoxicity, that is aminoglycosides, are potent broad spectrum antibiotics that acts through inhibition of bacterial protein synthesis and are used to treatment of gram-negative bacteria. Example is amikacin, gentamicin. These are the examples of aminoglycosides. The major side effect is nephrotoxicity, nephro and ototoxicity. Aminoglycosides are potent broad-spectrum antibiotics that act through inhibition of bacterial protein synthesis and are based in treatment of gram-negative bacteria. Kidneys are the major organs affected because these drugs retain in proximal tubules after glomerular filtrations. That is why nephrotoxicity is major side effects of aminoglycosides. It is retained in the proximal tubules. Next question. A child has chickenpox. The nurse will instruct the mother to use. The child has chickenpox. The nurse will instruct the mother to use oatmeal bath for healings and diphenhydramine hydrochloride with calamine lotions. Oatmeal bath for soothing and calamine lotion. Oatmeal cleansing bar and calamine lotion. Alpha curry lotion in the bath water. I already told it is a NCLEX type questions. Good evening, Sneha, Krishna Priya, Ashok. Second question answer, that is oatmeal bath for soothing and calamine lotions. Oatmeal bath will give a soothing effect and calamine lotion, as you know, it will reduce the irritability. Oatmeal bath is a homemade inexpensive solutions to soothe diaphragms, eczema and dry skin. It provides moisturizing, soothing and inflammation relieving for the skin. Next question, easy question. Installation of eardrops in adult would be. Installation of eardrops in adult would be. Pull the auricle downward and slightly backward. Pull the auricle upward and backward. Pull the auricle downward and slightly forward. Pull the auricle upward and forward. Installation of eardrops in adult. Third question. Okay, correct answer is upward and backward. Pull the auricle upward and backward. In the case of pediatric cases, in the case of pediatric cases, uh, pull the auricle downward and slightly backward in the case of pediatric. Pull the auricle upward and backward. That is in the case of adult. That is the difference. I will show you an example. This is adult case. So auricle is pulling upward and backward directions. Upward and backward direction. For the pediatric, downward and backward directions. Downward and backward direction in pediatric, upward and backward direction in the adults. For adults, eardrops instilled is by pulling the auricle upward and backward. For pediatric population, eardrops should be given by pulling the auricle downward slightly backward. Next question. Aluminum hydroxide will cause. Aluminum antacid will cause hypophosphatemia, hyperphosphatemia, hyponatremia, hypernatremia. Fourth question. Fourth question. Aluminum antacid will cause. Correct answer is hypophosphatemia. Aluminum antacid will bind with the phosphatase and it will not be available for absorptions. Aluminum carbonate antacids bind phosphate in the intestine and prevent it from being absorbed into the body, which will result in decreased levels of serum phosphate, that is hypophosphatemia. Next question. A nurse has just given a client a dose of a PRN or SOS medication, that is loperamide. It is also called Imodium. The nurse documents in the client's record that the clients received this medication for the condition of. A nurse has just given a client a dose of a PRN, that is SOS loperamide. It is also known as Imodium. The nurse documents in the client's record that the client received this medication for the complaints of diarrhea stools, abdominal pain, constipation, diarrhea. Fifth is in easy question. Most of us once in a lifetime it used. It is easy question. Please give your answer fast. Okay, that is for diarrhea. Loperamide is antidiarrheal drug. It is used for diarrhea. Loperamide is an antidiarrheal agent commonly administered after the client experiences loose stools. It is used to treat acute diarrhea and chronic diarrhea from disorders such as inflammatory bowel disease. So in both conditions, acute and chronic diarrhea, we can use loperamide, but you should use with the advice of doctors only. It is having some side effects also. Next question. The client with ovarian cancer is being treated with vincristine. The nurse monitors the client knowing that which of the following indicates a side effects of specific to the medication. A client with ovarian cancer is being treated with vincristine, that is chemotherapy. The nurse monitors client knowing that which of the following indicates side effects of specific to the medication. Diarrhea, hair loss, chest pain, numbness and tingling in the fingers and toes. The correct answer is option D, numbness and tingling in the fingers and toes. That is peripheral signs of peripheral neuropathy. One of the side effects of ingrestin, that is peripheral neuropathy. A side effect of specific to the ingrestin is peripheral neuropathy, which can be manifested as tingling and numbness in the fingers and toes. Depression of the Achilles tendon reflex may be the first clinical sign indicating peripheral neuropathy. Depression in the clinical Achilles tendon reflex, that is, while we are doing Achilles tendon reflex in physical examinations, it will be reduced reflex. So that is the first sign of peripheral neuropathy. Next question. The nurse is caring for an older client who is receiving Triazolam. It is an example of benzodiazepine. A nurse assesses the client closely for which adverse effect of this medication. A nurse is caring for an older client who is receiving Triazolam. The nurse assesses the client closely for which adverse effect of these medications: urinary retention, impaired mobility, constipation, blood clots. Triazolam usually given for to treat insomnia. Okay, correct answer is impaired mobility. Triazolam main adverse effects or side effects is impaired mobility. Triazolam is usually given for treating insomnia. It is an example of benzodiazepine. In older clients, medications are metabolized and excreted more slowly. Therefore, the risk of adverse effects is increased. So in geriatric patients, the medications are metabolized and excreted very slowly. Therefore, the risk of adverse effect is increased. In geriatric cases, we will give very minimal dose only to get adequate reactions. If it is not getting adequate action means we will gradually increase the dose. But in initial condition for geriatric patients, we will give very minimal uh, dose only. So compared to adult dose. Triazolam can cause confusion, dizziness leading to impaired mobility. That is why adverse effect impaired mobility is there. It will cause confusion and dizziness. Next question. A physician orders a Diltiazem hydrochloride intravenous bolus followed by an IV infusion of the same medications to control a rapid atrial fibrillation. In preparing the medication, the nurse is aware that a physician orders a diltiazem hydrochloride intravenous bolus followed by an IV infusion of the same medication to control rapid atrial fibrillations. In preparing the medication, the nurse is aware that a diltiazem hydrochloride bolus must be pushed very rapidly over a period of 2 to 3 seconds. A diltiazem hydrochloride infusion should not infuse more than 24 hours. Diltiazem hydrochloride is one of the most effective beta blocker is treating dysarrhythmias. Last option, diltiazem hydrochloride increases myocardial contractility and increases oxygen demand. So you need to find right statement, true statement regarding diltiazem administration. Options are very long one, that is why it is given smaller. That I will read once again. Options. If it is not clear means I will read it once again. A diltiazem hydrochloride bolus must be pushed very rapidly over a period of 2 to 3 seconds. A diltiazem hydrochloride infusion should not infuse for more than 24 hours. Diltiazem hydrochloride is one of the most effective beta blocker in treating dysarrhythmias. Diltiazem hydrochloride increases myocardial contractility and increases oxygen demand. Vibin 9, please comment in comment section. So I will give. Correct answer here, a diltiazem hydrochloride infusion should not infuse for more than 24 hours. That is the true statement regarding diltiazem administrations. It should not administer more than 24 hours. Infusion. A diltiazem hydrochloride is a calcium channel blocker. It is not a beta blocker. It is a calcium channel blocker that is used to treat atrial flutter or fibrillations. It acts to decrease myocardial contractility and thus decreases oxygen demand. A bolus of 0.25 mg per kilogram is administered slowly over 2 minutes period. A continuous drip of 5 to 10 milligram per hour may be continued for up to 24 hours. So that is the technique of administration of diltiazem hydrochloride. So these are NCLEX question. Vipin you can use for DHA also. Next question. A hospitalized client with diabetic mellitus receives neutral protamine hagedron, that is NPH insulin in the morning. The nurse monitors the clients for hypoglycemia, knowing that the peak actions occurs. A hospitalized client with diabetic mellitus receives NPH insulin, NPH full form that is neutral protamine hagedron in the morning. The nurse monitors the clients for hypoglycemia, knowing that the peak action occurs 2 to 4 hours after administration, 4 to 12 hours after administration, 12 to 16 hours, 18 to 24 hours. Ninth question. The correct answer is NPH insulin peak hours, that will be 4 to 12 hours after administrations. Peak hours. That means the maximum action, that is a peak hour, maximum action of the drug. That will be for NPH insulin 4 to 12 hours. NPH insulin is an example of intermediate acting insulin. The onset of action. After administrations, action will start within 3 to 4 hours. So peaks, that will the maximum effect of action will get within 4 to 12 hours, and duration of action is 16 to 20 hours. So the duration of action of the NPH insulin will stay up to 16 to 24 hours. Next question. An adult client with hypothyroidism is admitted to the hospital. On admission assessment, the nurse notes that the client is taking a maintenance dose of levothyroxine. The nurse transcribing the medication prescription by knowing that the normal adult maintenance dose of this medication is. An adult client with hypothyroidism is admitted to the hospital. On admission assessment, the nurse notes that the client is taking a maintenance dose of levothyroxine. The nurse transcribing the medication prescription by knowing that the normal adult maintenance dose of this medication is 0.025 mg to 0.05 mg daily, 0.075 mg to 0.1 mg daily, 0.05 mg to 0.075 mg, 0.1 mg to 0.2 mg daily. Maintenance dose of levothyroxine. So usually levothyroxine is coming in microgram. levothyroxine is coming to our hospitals and all. It is in microgram. So here milligram is given. So maintenance dose of levothyroxine, that is usually 0.1 milligram to 0.2 milligram daily. That means in microgram, 100 micrograms to 200 microgram per daily. That is maintenance dose of levothyroxine. So we will get levothyroxine in 100 micrograms or 25 microgram tablets. That means that is in microgram. When it is converted into milligram, it will be 0.1 milligram. It will be 0.025 milligram. The normal maintenance dose of levothyroxine in adult is 0.1 to 0.2 milligram per day, but it depends upon the patient. So sometimes patient will get a dose of 25 microgram also. So that is depends on patient. For infants 0 to 6 months of age, 0.025 to 0.05 milligram per day. For children up to 12 months of age, 0.05 to 0.075 milligram per day. And for children up to 5 years, 0.075 to 0.01 milligram per day respectively. This is recommended dose, but your physician only the deciding person. Next question. A client has a prescription to take Guaifenesin, that is Myasthenic tablet. The nurse determines that the clients understand the proper administration of this medication if the client states that he or she will. A client has a prescription to take Guaifenesin or Myasthenic tablet. The nurse determines that the client understands the proper administration of this medication if the client states that he or she will. Take an extra dose if fever develops. Take the medication with the meals only. Take the tablet with a full glass of water. Decrease the amount of daily fluid intake. Mucinous tablet you might be seeing that we need to put in a glass of water. So it will gives bubbles. That is a mucinous tablet. Correct answer is option C. It should be taken with a full glass of water. Mucinous tablet should be taken with a full glass of water. Guaifenesin or mucinous tab, that is an expectorant. So mucinous tablet is given for producing a sputum, that producing cough, that is expectorant, and should be given with a full glass of water to decrease the viscosity of secretions. So usually in dry secretions or thick secretions, we will give mucinous tablet to make that secretion in a thinner secretions. That is why Guaifenesin or mucinous tablet is administering. So always give mucinous tablet with full glass of water. Next question. A nurse caring for a client with a right-sided heart failure, congestive heart failure, had formulated a nursing diagnosis of excess fluid volume. The client has been on furosemide or Lasix for 3 days. The nurse determines that the outcome criteria have not been successfully met if the client has. A nurse caring for a client with a right-sided heart failure or CHF had formulated a nursing diagnosis of excess fluid volume. The client has been on furosemide for 3 days. The nurse determines that the outcome criteria not been successfully met if the client has high daytime urinary output, nocturia with daytime oliguria, serum blood urea nitrogen of 20 mg per deciliter, serum creatinine of 0.9 mg deciliter. First, you need to understand the pathophysiology of congestive heart failure or right-sided heart failure. Then only you can answer this question, because the criteria have not been successfully met. In right-sided or congestive heart failure, there will be fluid retention. That is why we are administering diuretics. Okay, we'll check the correct answer here. Correct answer is nocturia and daytime oliguria. Nocturia with daytime oliguria. That is the correct answer here. Means during the night time, the edematic, that is fluid will go into the blood vessels. That will cause nocturia, increased urination at night time. And daytime, urination will be very less. Oliguria will be there. That is the that is a failure, that is not successfully met by diuretics. After administration of diuretics, usually daytime urination will be high and night urination will be less. That is the expected outcome, but here it is not successfully met. In that condition, nocturia will be there daytime. With a right-sided heart failure, fluid pools in the interstitial space of the periphery of the body. Because of the fluid retentions, the fluid will store into the interstitial space, usually during the daytime. So that is why we are administering diuretics to remove that fluids, extra fluids. So at the night time, which affects the gravity eliminated, fluid re-enters into the bloodstream and is eliminated by the kidneys, producing nocturia. This indicates medical therapy is not yet effective. If night time there is more urination, that means the therapy is not effective. Next question. A client is taking trihexyphenidyl for the treatment of Parkinson's disease. The nurse should assess for which of the following as an adverse effect of the medications. A client is taking trihexyphenidyl, usually a short form we are using THP, for the treatment of Parkinson's disease. The nurse should assess for which of the following as an adverse effect of the medications: urinary incontinence, urinary retention, diarrhea, excessive perspiration. THP is most commonly used in psychiatric areas. With most of the antipsychotics will be administered with along with trihexyphenidyl to reduce the extrapyramidal symptoms. So in this condition, patient will have side effects of urinary retention. Urinary retention is one of the adverse effect or one of the side effects of THP or trihexyphenidyl. The common brand name is Parkin. Trihexyphenidyl is an anticholinergic medication. Thus, it can cause urinary hesitancy and retention, constipation, dry mouth, and decreased sweating also may be due to the trihexyphenidyl. These are the main adverse effects of the trihexyphenidyl: urinary hesitancy and retention, constipation, dry mouth, decreased sweating. Next question. Trimethoprim sulfate, usually known as Bactrim in the company name Bactrim, is prescribed to be administered by intravenous infusion to the client with a recurrent urinary tract infection. A nurse would administer this medication. Trimethoprim sulfate or Bactrim is prescribed to be administered by IV infusion to a client with a recurrent UTI, a nurse would administer these medications. Over 30 minutes, over 60 to 90 minutes, piggybacked into the peripheral line contained parenteral nutrition, piggybacked into the existing infusion of normal saline with KCl. Okay, we'll check the correct answer. Correct answer is over 60 to 90 minutes. Trimethoprim sulfate or Bactrim IV infusion should be administered over 60 to 90 minutes. Bactrim is an antibiotic, may be administered by an IV infusion but should not be mixed with any other medication or solutions. Bactrim should not be mixed with any other medication or solutions. Bactrim is infused over 60 to 90 minutes, that is 1 to 1.5 hours. And bolus and rapid infusion must be avoided. Next question. The nurse is performing an assessment for a client with myasthenia gravis. The nurse determines that the client may be developing myasthenic crisis if the client states. A nurse is performing an assessment of a client with myasthenia gravis. The nurse determines that the client may be developing myasthenic crisis if the client states, I took my pills late last night. I can hardly think straight today. I dropped one of my pills on the floor. I can swallow very well today. So this is the last question today. So please make your answers fastly. Myasthenia crisis. Signs and symptoms of myasthenia crisis. Just to think about it and answer. Okay, we'll check the correct answer here. Correct answer is I can swallow very well today. That is dysphagia. Dysphagia is one of the early symptoms of myasthenia crisis. Dysphagia is a classic sign of myasthenia gravis exacerbations. Observing how a client is able to ingest food is an important assessment of medication administrations. So dysphagia is a classic sign of myasthenia gravis exacerbation or myasthenia gravis crisis. Observing how a client is able to ingest food is an important assessment of medication administrations. So that is about today's video. So we finished the 2 videos today. One is about cardiovascular system, pharmacology, and this is pharmacology NCLEX type questions with explanations. So not tomorrow, next video we will discuss about microbiology questions. So thank you for joining with me. And if you are interested, means you can share with your friends. Next video we will meet with the microbiology questions and answers. If you have any question, means you can put your doubt in comment sections. I will try to answer. And any suggestions, any complaints, means that also you can put it in comment sections. So thank you. Good night for today.